going over blood pressure. When we bring our patient back either to the exam room or to our vital station, some facilities have a vital station, a designated area. It could be in a hallway, it could be a separate room. We take our patients in there and we do a full set of vitals: height, weight, blood pressure, pulse ox, respirations, temperature. You have all of these things that you have to do with each and every visit for each and every patient. Now, here's the thing: depending on the type of visit, some providers only want you to do certain vitals. So make sure that you speak with your provider to get an idea of what vitals they want done for what type of visit. So today we're going to be going over blood pressure, more specifically manual blood pressure. I know that everybody has machines and everybody uses machines, and anybody can push a button on a machine. Now, if you are in a facility that has an automatic machine, if you get an error or you get a too high or too low reading, they will want you to go in and double check with a manual blood pressure. We'll be doing a blood pressure. We need our patient to be sitting. Their legs are to be flat on the floor or hanging down. We do not want their legs crossed. This will give us an inaccurate reading. If this patient is on dialysis and has a fistula or has anything in this arm or had any sort of surgeries on this arm, we would not use this arm. We would check for the other arm. If for some reason we were not able to do the upper part of the arm, we could do the lower part of the arm. We could do the thigh as well as the lower part of the leg. It really does depend on that patient. We have to do a pulse ox. We would put the pulse ox on the opposite hand than the blood pressure cuff. We will never put our pulse oximeter on the same hand as the arm that we are doing our blood pressure. We are going to make sure first and foremost that the cuff size that we have is the correct size cuff for that patient. We do not want to use wrong size cuff for a patient because it will give us an inaccurate reading. So we use our standard adult size for our standard size adults. If this was a pediatric patient, we would use a pediatric cuff.